Hello everyone, welcome to another session of Youth in Pre Med. Today we'll be learning about radiology. And before we dive deep into radiology, let's do an icebreaker question to preview what we'll cover. So have you ever taken an X-ray or any imaging procedure? If so, what for? And you can put it in the chat.
And you can also talk about the X-ray procedures that you've heard of if you've never taken one.
Yeah. So you sprained your ankle, so you had an X-ray. After slamming your finger in the car, you sprained your ankle, teeth, wrist, teeth. All right, so your cat has an X-ray. That's really cool. Ankle, teeth. All right. So all of your answers are great examples, and you'll learn more about imaging from this presentation.
Let's start off getting a better understanding of what radiology is. So radiation is the transfer of energy through waves, and this can be in the form of heat, sound, or light. Radiology is the branch of medicine of which doctors work with diagnostic images of anatomical structures. One example, like you guys mentioned, would be X-rays, and these diagnostic images are made through radiation. The doctors that work with radiology are called radiologists. And now we're going to move on to MRI scans.
It looks like the person who is going to read this slide is not here today, so I'll probably try to read it. So the first type of scans we're going to talk about are MRI scans. MRI stands for magnetic resonance imaging. An MRI scan is a device that uses a large magnet, radio waves, and a computer to create detailed images of inner organs and structures. You may have seen these in movies where the patient is moved into the machine for scans of their body and brain. They are used to spot anomalies in the brain and spinal cord, tumors, cysts, breast cancer, certain heart problems, and certain diseases. These heart problems and diseases include pericarditis, inflammation of the tissue that surrounds the heart, and tumors. To check for abnormalities, one of the ways is to compare it to the previous scans of the same area and look for anything that seems different. You can also compare the MRI scans to other scans, like CT and CAT scans. The procedure for an MRI scan is pretty simple. Before the scan, the patient takes off all metal, jewelry, or accessories, as they can interfere with the magnet. The patient then changes into a gown and is given medication if needed in the situations where the patient is nervous or anxious. The patient then lies down on the scanner and is given headphones to block out the sounds, which are often described as loud clanging noises. Next, we'll move on to CT and CAT scans.
Now let's move on to CT or CAT scans. These are when doctors use X-rays in a computer to picture your tissues, bones, and organs with cross-sectional images, and they help them see inside your body. It's important to note that these show even more detail than a standard X-ray. The equipment used is a computer, X-rays, a CT scanner, which is a machine that's kind of shaped like a donut, and it's in at the top left corner, an examination table that enters through, and then the X-ray tubes and electronic X-rays rotate around you, and they're opposite of each other in a gantry or a ring. The placement of the equipment is shown in the picture at the bottom, and the whole procedure lasts from about a few minutes and up to half an hour. CT or CT scans are extremely helpful for many things, like locating bone or joint problems, spot cancers, heart diseases, and internal energies like bleeding. Additionally, they help us locate tumors, infections, excess fluid, and blood clots. Finally, doctors use these scans to help understand if the treatments they're giving are working and helping by seeing if there's progress. These scans show a cross-section of your body, and you can see your bones, organs, and soft tissues more clearly than a normal X-ray. Other interesting facts include the scan being completely painless. And another fun fact is that the very first CT or CAT scan that was done was in 1972 by a British engineer named Godfrey Hounsfield. And the use of these scans have tripled over the past 15 years. Now let's move on to ultrasounds.
So now let's talk about ultrasounds. Many of you may have heard of ultrasounds before, but they are a type of X-ray that uses high-frequency sound waves to see and produce images of structures inside your body. Usually, it takes anywhere between 30 minutes and an hour to conduct an ultrasound. The equipment needed is usually a type of water-based gel that is spread over the skin on the area that you are examining. Then, a sonographer will press a transducer, a small and handheld device, against the area being examined, and usually moves it a few times to produce the images. The transducer will produce sound waves that go into your body and will collect other sound waves from within your body that bounce back. The sound waves from within your body are sent to a computer, which is where the images are created. Other times, an ultrasound will be done within the body, in which a transducer will be attached to a probe that will be put into a natural opening in your body. An ultrasound can reveal many things, such as a baby while it is still in its mother's womb, to assess its growth and health, detect possible gallbladder disease, genital and prostate problems, guiding a needle for biopsy or tumor treatments, and much more, such as evaluate blood flow and metabolic bone disease. You can analyze an ultrasound by remembering that fluid is always shaded black on an ultrasound, and they can also be gray, while bright white usually tends to be bone. And that's it for ultrasounds. So now we'll move on to mammograms.
A mammogram is an X-ray image of the breasts used to screen for breast cancer. Breast cancer is usually seen in the form of a tumor, but there are other abnormalities that may appear. Tumors and abnormalities usually appear as a white mass. Mammograms play a key role in early breast cancer detection and help decrease breast cancer deaths. A mammogram can be used either for screening or for diagnostic purposes. Screening mammography is used to detect breast changes in women who have no signs or symptoms of new breast abnormalities. The goal of screening mammography is to detect cancer before clinical signs are noticeable. Diagnostic mammography is used to investigate suspicious breast changes. It's also used to evaluate abnormal findings on the screening mammogram. Mammograms are usually done on women with high risks of breast cancer. However, many women with average risks of breast cancer begin mammograms at age 40 and have them every 1 to 2 years. The top left picture shows a woman getting a mammogram and the radiologist investigating the results. In the top right picture, you can see a breast tumor, which appears as a white mass that was detected by a mammogram.
I believe our volunteer for the slide isn't here, so I guess I'll take over. So fluoroscopy is an imaging technique that uses X-rays to obtain real-time moving images of the interior of an object similar to an X-ray movie. It's great for watching body movements and processes as they occur in real time. Most of the time, this procedure takes around 30 minutes, but having small bowel study can take up to 4 hours. During the fluoroscopy procedure, a continuous X-ray beam is passed through the body and is then transmitted to a TV-like monitor so the body part and its motion can be seen in detail. Since you are taking numerous X-rays to watch these active processes, one downside is that the radiation dose can be quite high. This tool enables physicians to look at many body systems, including the skeletal, digestive, urinary, reproductive, and the respiratory system. Additionally, it can be used to evaluate specific areas of the body, including the bones, muscles, joints, as well as solid organs. Fluoroscopy is used in many types of examinations and procedures, such as X-rays and biopsies.
Let's talk about a PET scan, a very unique scan with a crucial purpose. PET stands for positron emission tomography. Positron meaning a type of subatomic particle that has the same mass as an electron but having a positive charge. Emission being the releasing of these particles, and tomography being the type of image it produces, such as in the bottom right corner, an image that is kind of like slices. When taking a PET scan, you are given a radio tracer, which is a special dye that makes use of trace amounts of radiation. This radio tracer can be taken through pill, gas, injection, or be drunk. The radio tracer, which is usually glucose-based, but can vary for purposes such as blood flow, which use another substance such as oxygen because it will react with your red blood cells and stick to your red blood cells. All of these radio tracers will emit positron particles, and these emission of positron particles will create gamma rays. The gamma rays are what's actually read by a machine and turned into an image. Now, when the tracer is taken, it will usually take an hour to circulate or reach the targeted areas in your body. You are then put on a bed and moved into the scanner slowly. It's the same as a CT or CAT scan, and you remain very still for the process. The technician may tell you to hold your breath during this process. So, why a PET scan? A PET scan can observe blood flow and see which cells take in more glucose or more energy. And different cells, such as cancer cells and certain brain cells with disorders in them, take in glucose differently. And this would be seen as the very bright spots in the image. The very large benefit of a PET scan is being able to see things on the cellular level. That's all for scans. Now on to X-rays.
So what are X-rays? X-rays are a type of radiation called electromagnetic waves. The imaging creates pictures of the inside of your body in different shades of black and white. This is because different tissues absorb different amounts of radiation. So the naked eye actually can't see the radiation of X-rays, and you also can't feel them. X-rays can be used to examine most areas of the body. They're mainly used to look at the bones and joints, although they are sometimes used to detect problems affecting soft tissues such as internal organs. Some problems that may be detected during an X-ray include bone fractures and breaks. Next, I'll pass on to Emma.
Hello, this type of X-ray is kidney, ureter, and bladder, which is an X-ray that allows doctors to assess organs in your gastrointestinal and urinary system. So what are the kidneys, ureter, and bladder? Well, let's start with how the urinary system works. Your body takes nutrients from food and converts it into energy, which leaves waste products. The urinary system helps to eliminate the liquid waste. So the kidneys remove liquid waste from the blood, balances substances in the blood, and it also regulates blood pressure. The ureters are what carry the waste from the kidneys to the bladder, and the bladder holds the waste. Moving on, this type of X-ray can detect certain tumors, intestinal blockage, and kidney stones. For equipment, an X-ray machine would be carefully placed on the part of the abdomen, which would then be X-rayed between the X-ray machine and a cassette containing the film or the digital media. Someone might need this X-ray if they're having abdominal pain or just to take basic information like the size, position, or shape of the kidneys, ureter, and bladder. As for analyzing, there's a few things a radiologist might look for, like gas pattern, extraluminal gas, calcifications, or kidney stones in the kidneys or ureters. They might also look for areas that have increased density and soft tissue masses. That's all for this X-ray, and we'll be moving on to teeth and bones X-ray.
Now we'll be talking about teeth and bones X-rays. Teeth and bones X-rays are images of teeth, bones, and the surrounding tissues, so any problems in joints, teeth, or bones can be detected through these pictures. There is equipment used when taking these X-rays. For teeth, a panoramic dental X-ray machine, dental cone beam, or intraoral X-ray machine is used. A panoramic dental X-ray machine is taken extraorally, meaning from outside of the mouth, and is used when the entire mouth needs to be captured in one image. A dental cone beam is used when it is necessary to produce three-dimensional images of your teeth, soft tissues, and bone in one scan. An intraoral X-ray machine is when the X-ray film is inside your mouth and they provide a lot of detail about your teeth to the dentist. This X-ray helps the dentist check for cavities and infections. For bones, projectional radiography is used. Projectional radiography is used to look at the bones and identify bone fractures and to look at soft tissue surrounding the bones to see if there's any damage. The imaging taken through this equipment will reveal different problems such as cavities, infections, and hidden dental structures for teeth and fracture, arthritis, and bone loss for the bones. These images then have to be analyzed in order to know what the problem is. In images of the teeth, dentist looks for cavities, infections, and other hidden dental structures through color disfiguration and by seeing if there are different structures of the teeth. In images of the bones, doctors identify the bone, the fractured part of the bone, and identify the type of fracture as well as fracture displacement. Arthritis can be spotted through spaces, fractures, and erasures that can be seen in the joints through the X-rays. X-rays for the teeth and bones are used when someone has pain in their teeth and joints or feel discomfort or pain in areas surrounding their bones. That's all for teeth and bones X-rays. I hope you learned something new.
We are now going to talk about chest X-rays. Chest X-rays help produce images of your heart, lungs, bones near your chest, and your spine. To conduct these X-rays, an X-ray machine, which can be portable or not, has a metal arm that goes over a person. Then a recording plate contains film or a sensor that records images. Chest X-rays can detect pneumonia, lung cancer, heart failure, and emphysema, which is a lung condition that causes shortness of breath and more. Chest X-rays are used when someone has chest pain, a chest injury, or any shortness of breath. On the left is an example of a scan from a chest X-ray. To analyze a chest X-ray film, you can use A, B, C, D, E. First, look at the airway or trachea and check if anything such as foreign objects are obstructing it. Next, look at the lungs and note if there are any collections in the lungs, collapsing in the lung segments, or any differences between the two lungs. Behind the trachea is the heart, and note if the heart is enlarged, which indicates heart disease. Then in the ribs, check if there are any fractures or displacement in them. Lastly, check everything else in the scan. In the skin, note if there are any fragments or subcutaneous emphysema, which are air bubbles in the skin.
Lung X-rays are X-rays of your lungs. The equipment typically used for lung X-rays consists of a wall-mounted, box-like apparatus containing the X-ray film or a special plate that records the image digitally. An X-ray producing tube is positioned about 6 feet away. The equipment may also be arranged with the X-ray tube suspended over a table on which the patient lies. A drawer under the table holds the X-ray film or digital recording plate. A portable X-ray machine is a compact apparatus that can be taken to the patient in a hospital bed or the emergency room. The X-ray tube is connected to a flexible arm that is extended over the patient while an X-ray film holder or image recording plate is placed beneath the patient. Lung X-ray images can detect and reveal many kinds of lung issues, some including pneumonia and lung cancer. To analyze lung X-rays, first check the airways. Ensure trachea is visible and in midline. Next, check bones. Check for fractures or dislocation, as well as soft tissues for foreign bodies and surgical clips. After that is cardiac. Check heart size and heart borders, aorta, and heart valves. Next, check the diaphragm. The right side should be higher than the left. After that, check for fusions. Identify the major fissures. If you can see them more obvious than usual, then this could mean that fluid is tracking along the fissure. Additionally, look at the lung fields and check for infiltrates, as well as identify the pattern of infiltration. Next, check the gastric air bubble. Check for the correct position and look for free air. Finally, check the hilum for correct position and size, as well as enlarged lymph nodes and mass lesions. Lung X-rays are used when one is feeling lung-related issues, such as shortness of breath, but also when it's suspected with an issue in the lungs. Now let's hear about abdomen X-rays.
Next, we'll talk about abdomen X-rays. Let's start with what are abdomen X-rays. Abdomen X-rays are basically what they sound like, an X-ray or image of the inside of the abdomen. The abdomen is also known as your belly area. Specifically, an abdomen X-ray uses ionizing radiation to produce an image of your stomach, liver, intestines, spleen, gallbladder, pancreas, and that overall area. You can see a picture of an abdomen X-ray and the different parts of the abdomen labeled in the top right corner. The main equipment used for an abdomen X-ray is an X-ray machine. An X-ray machine is large. It comes down from the ceiling and it actually works to make an image of your abdomen. Also, a patient will lie on an x-ray table while getting an x-ray. Inside of this table is a drawer that holds the x-ray film or digital recording plate. If the patient is unable to leave their hospital bed or is in their emergency room, a portable x-ray machine might be used. A portable x-ray machine is a compact piece of equipment that can be transported to where the patient is. Abdominal x-rays can reveal two things: if your abdomen is normal or if there's a problem. It might reveal that your abdomen has kidney stones. Kidney stones are hard deposits of minerals and salt inside of your kidneys. It can also reveal a foreign object that has been swallowed or a hole in the stomach or intestine. Abdomen x-rays can show injured abdominal tissue or an abdominal mass. An abdominal mass is an abnormal growth in the abdomen. Other things it can reveal are fluid buildup in the abdomen, blockage of the intestines, and maybe even gallstones, which is a hardened deposit in the fluid of your gallbladder. Another thing abdomen x-rays reveal is if one of your organs are enlarged and if they are in the right place. Overall, an abdomen x-ray reveals if your abdomen and everything in it is normal and healthy, or if it is abnormal and something is wrong. It can then reveal what exactly is wrong with your abdomen. Now let's go over how to analyze an abdominal x-ray. One brief way to analyze an abdominal x-ray is with the method Abdo-X. The A stands for air. This means that in the x-ray, you should only be able to see air in the large and small bowel. On the x-ray, air sort of looks like a darker gray color. If you see air anywhere else, this could be a sign of an issue. The B stands for bowel. The small bowel is recognized by its middle position and lines coming down the width, while the large bowel is found away from the center and has lines coming down part of the way across the width. D means dense structures or bones. When looking at abdominal x-rays, you should look at the pelvis, the vertebrae, and the ribs. O stands for organs and soft tissues. To analyze the organs, such as the liver, kidneys, and spleens, one should look at the outlines and determine if they look larger than usual. Lastly, X stands for external objects, foreign bodies, lines, and tubes. You should look for any of these things on the x-ray to determine if there is a problem. In short, in order to analyze an abdominal x-ray, one can use the method Abdo-X in order to determine if there are any issues. Next, it's important to know when abdomen x-rays might actually be used. The times an abdominal x-ray is used is when someone experiences abdominal pain or unexplained nausea, if there is a suspected problem in the urinary system, when someone has a blockage in their intestine, when someone has swallowed an object, and an abdomen x-ray helps to diagnose suspected diseases or conditions if someone has reason to believe they have a certain disease. As you can tell, abdomen x-rays are very useful for a number of reasons. To end off abdomen x-rays, let's discuss some fun facts. First, one of the weirdest things found on an abdominal x-ray was a light bulb in a man's large intestine. Also, another abdominal x-ray showed a 7-inch kidney stone that weighed 2.5 pounds. Keep in mind that kidney stones are usually considered large if they're over 5 millimeters. That covers abdomen x-rays, and now we'll talk about how to prepare for different scans.
Okay, so now let's go over how to prepare scans. What this means is basically what steps or precautions you should take before doing one of those scans that we have learned in previous slides. The first one is an MRI scan, also known as magnetic resonance imaging. So before an MRI scan, you should eat normally and continue taking your regular medications, unless otherwise instructed. You'll also be changing into a gown and taking off any accessories that might affect imaging. Some of these accessories include jewelry, hairpins, eyeglasses, watches, and more. Second is the CT or CAT scan. So to prepare for a CT or CAT scan, you need to refrain from eating or drinking a couple hours prior to the scan. When in a hospital and in the medical room, you will need to change into hospital gown. Lastly, you want to remove any metal objects that might get in the way during the process of scanning. So like MRI scans, it includes jewelry, eyeglasses, dentures, and more. There is the ultrasounds. So to prepare for ultrasound scan, you may be advised by a doctor either to drink water or not to go to the toilet until after the scan. This is mainly needed for when they want to scan your unborn baby or your pelvic area. Sometimes they can also advise you to avoid eating or drinking for several hours before a scan, which is mainly for when they want to scan your digestive system. When you're about to scan, the doctor will instruct you to change into hospital gown like the other ones. Then they may give you some medications that help you relax, and they can also give you an injection, which is harmless and it helps make the images scan more clearer. All right, to prepare for a mammogram scan, you'll need to choose a mammogram facility and schedule for a test date where your breasts will be less tender. Usually this means the week after your menstrual period for women. You will also want to bring your previous mammogram images if applicable. This is just so that it allows your radiologist to compare past and current images. You also do not want to put on deodorant before your mammogram scan as it can cause confusion for the machine. Lastly, if you find mammogram scans uncomfortable, you may want to consider medications such as aspirins to ease the discomfort. To prepare for a fluoroscopy scan, you will generally want to write down any questions or concerns you have so that you can discuss with your doctor prior to the procedure. Then you will need to sign a consent form, which gives the doctor permission to perform the procedure on you. If you're breastfeeding, you will also want to let your doctor know, as well as if you have any allergies. Lastly, you will want to ensure that the doctor has a list of all your medications. This is just so that your doctor knows what kind of specific procedures to perform or not to perform on you. To prepare for a PET scan, otherwise known as positron emission tomography, prior to the procedure, it is highly suggested to tell your doctor about your allergies, medical condition, breastfeeding, or if you're pregnant. This is just if it's applicable for you. In addition, 48 hours before the PET scan, you should not do strenuous exercise. 24 hours before, you need to have a no sugar diet and stay at a very low carbohydrate diet. 6 hours before, you should not eat anything, but you may drink water. In fact, it's highly encouraged to drink water. All right, next slide. Okay, so to prepare for a kidney or ureter and bladder x-ray, you want to notify your radiologist if you're pregnant or if you suspect that you're pregnant, and if you have taken any medications 4 days prior that contains bismuth. This is because bismuth may interfere with the testing procedure. Usually there are no prior preparations such as fasting, but always listen to what your doctor instructs you to. To prepare for teeth and bone x-ray, there is usually no special preparations prior, but for dental, you may want to brush your teeth for just hygienic purposes. Also, always listen to what your doctor advises you for all of these scans, as they do know the best. All right, I hope you learned something new regarding how to prepare before a scan. Next, you guys will be learning about the different risks of scans.
Hi, now let's talk about the risks of different types of imaging. First up, we have MRI scans. As you have learned today, MRI scans use magnetic radio waves to picture the tissues and the internal organs. So that means there's no radiation involved, so it's pretty safe. One risk might be there if there's metal inside your body. For example, if you have metal artificial joints or a metal pacemaker, this can interfere with the imaging and probably cause some damage. Similar to MRIs, ultrasounds do not involve any radiation, and they also use sound waves to create the image. Ultrasounds are very safe, and there are typically no risks involved. Next, we have CT or CAT scans. CAT scans do use a high dose of radiation, which may increase a person's risk of developing cancer. Another risk is if a person has an allergic reaction. If a person is allergic to certain materials like IV dye or iodine, they may develop a rash and some redness. Then we have mammograms. Mammograms also use radiation to create the image, so there's a risk that a person may develop cancer later in life. This happening is quite rare as the radiation doses are highly regulated and are pretty low. Another risk is that if a person has implants or something, they might rupture, and if they have some allergic reactions, they may develop redness and itchiness. Next slide. Okay. Next up, we have fluoroscopy. And I think there's a typo, but they do use high doses of radiation. And so the chances of cancer do increase. And then we have PET scans. Once again, if you're allergic to certain materials like iodine, aspartame, or saccharin, you may develop an allergic reaction. And this may lead to redness, itchiness, and more. PET scan also uses radiation, and radiation exposure may increase chances of cancer. And lastly, we have X-rays. X-rays also use radiation, so there's again a small chance that a person may develop cancer later. And however, this is pretty rare as X-rays use a very low dose of radiation. However, if high doses are used, this may result in skin reddening hair loss, and tissue effects such as cataracts. That's it for the different types of imaging, the risks of different types of imaging, and next up we have the questions.
So if you have any questions, like could you go back to the previous slide, or could you explore more about a specific topic, you can type it in the chat.
And as we're waiting for questions, I think on the next slide, it also mentions our journal, the Weekly Med. And I think one of our volunteers wrote an article about radiology. So if you'd like to read more about that, you can check it out on our website as well. Yeah, and then Rowan also put in the links to the website and our email and also our Instagram. So we do have a question about whether you have to wear a special lead shirt when getting an X-ray. Do any of the volunteers want to answer that?
I guess I'll answer that. So the special lead shirt is like, you see, you get a special lead shirt at the dentist, right? So they don't want because they don't want the radiation going to other areas except your teeth. But if you're having such as like a chest X-ray and then they put on a lead shirt, you can't see anything. So it really depends. So like I know I had a wrist X-ray for bone age, so they put a lead shirt because they don't want my chest. But other than that, it really depends.
Yeah, there are definitely like different procedures for different types of X-rays that we went over today. So if you do have additional questions, you can always reach out to us through email. And then we can tell you more about the different types of X-rays. And then we also have another question. Looking at the list of risks, the radiologists themselves also have some kind of risk. For example, increase of cancer later in life.
I can answer this one. You know how like when you get an X-ray on your teeth at the dentist, they leave the room to do the thing, like as the X-ray is scanning. Since having one X-ray like a year is usually very safe. It's very low radiation, like total. But if a radiologist is in the room every single time, they might have a higher risk. So that's why they usually leave to lower their risk since they are constantly exposed.
Yeah, and then I also noticed that you mentioned that it's good to keep radiation in one specific area to prevent any risks. I think that's also true, especially for like cancer treatments when you're receiving radiation. Okay, and then if there are no further questions, thank you guys for coming. Next week, we won't be having a session, but our next session will be on April 11th with a speaker from Genentech. Her name is Andrea Cortez, and she's going to be talking about the work of Genentech and then also her journey to Genentech because it's really hard to get a job there. And she's going to talk more about genetic engineering and like biotechnology and different advancements that are being used to treat different diseases such as really deadly types of breast cancer and also cystic fibrosis, which is something we discussed last semester. But cystic fibrosis is a disease where there's lots of mucus in your lungs, and then it can cause early death and a lot of other symptoms. And yeah, like Connie mentioned, Genentech is an amazing biotech company, and it's located really close by. It's in South San Francisco, for a lot of us in San Francisco. And we had to go through a lot of like confidentiality and approval from Genentech to get a speaker to come to our session. So you guys should definitely come to the next session and bring a lot of questions for Andrea Cortez. And if you don't have any further questions, you're free to go. But if you do have further questions or you want to stick around to ask them privately, that's also an option as well. And have a really good spring break for the people who are having spring break this week.
Bye.
Bye.